Today I'm joined by a panel of Ms. Naomi Shopala, who is the Director of Privacy Healthcare Services in the Ministry of Health and Social Services. Thank you very much for joining us. And I'm also joined by Ms. G. Vasafal, who is the CEO of the Namibia Statistics Institution, who's also joined us this afternoon to discuss these issues. Would like to clarify that we were supposed to have the ED of Health to join us, but unfortunately he could not. But we do think it's important that we discuss quarantine activities, especially at a time such as this. So without wasting any time, I would like to ask Ms. Shopala, we understand that we have a few people in quarantine. We have facilities across the Khomas region and some in the Irongo region. What has been so far the experience of health workers taking care of those in quarantine, but also of those in quarantine at this time who have been tested positive with COVID-19?
Thank you so much for your question. Since we have started with intensive effort to contain the COVID pandemic, the Ministry of Health and Social Services have also started with the quarantining activity. Maybe first, I should inform our listener, what do we mean when we talk about the quarantining? Quarantining, we are not talking about people who are infected with COVID, but these are people who traveled from high-risk areas. They are asymptomatic, but we are keeping them aside so that they don't mingle with the community, just for the mere purpose that in case if any one of them is infected, we'll be able to pick that up early and address it without exposing a large number of people. Usually upon arrival, we keep the individual in the quarantine facility for 14 days. This is the established duration of incubation period. If they could have been infected from wherever they are coming from, they should have developed signs and symptoms during this period of 14 days. So, as you have rightfully said, we have facility here in Khomas, around 10 facilities. These are places where we keep them for that duration of 14 days, and the Ministry of Health is taking care of them. We have some facility in Ochozonjupa region, we have facility in Haldap region, we have facilities in Zambezi region, and all the other regions across the country have started to implement some kind of quarantine activities for people who are arriving in the country, either the truck drivers, people who are arriving by sea, and people who are arriving through ground crossing. At some of the facility where we have a lot of people, we have placed a nurse full-time because they are monitored every single day, checking their body temperature, which is one of the main symptoms in terms of COVID, where person develop fever, and also checking for the presence of other symptoms.
You say that these people would be seen to develop symptoms while they're in quarantine if they do have COVID-19. We have heard of the term asymptomatic. So if someone is in quarantine for 14 days and they fit in this category of asymptomatic, do you have measures in place to have a mandatory test to see if they are infected with COVID-19 or not? Or what are the measures that the nurse that is stationed there usually takes?
Yes, thank you again. First, I want to differentiate between testing and screening. So what we are doing with the individual in the quarantine facility, we screen them every day. We screen through the taking of temperature, through asking them if they have a cough, if they have general body pain, and other established sign and symptom for COVID. When we talk of testing, it's actually collecting a sample that is being sent to the laboratory for further analysis. For the people in quarantine, if they do not meet any of the case definition in terms of fever and cough, we do not conduct the test. Because remember, we are not taking blood to test. we are testing a swab through the mucus, and that need several days before we could identify or isolate the presence of infection from the swab. That's why we don't just go ahead and test everybody or anybody.
So how do you determine if someone is asymptomatic or not?
Thank you. Again, when we say is symptomatic, there is no presence of symptoms. There is no fever, there is no cough, there is no general body pain. Hence, there is no indication for conducting a test.
Thank you very much. So, Ms. Wasserfall, from the Namibia Standards Institution, you deal a lot with products of quality to ensure that they meet the standards of the World Health Organization, the sanitizers we use, the detergents in order to kill germs. What work has the Standards Institution done to ensure that the products meet the requirement as per the World Health Organization standards, and that if they do not do so, what are the actions to be taken?
Thank you very much for the question. The Namibian Standards Institution, as the national standards body, is responsible for the development and adoption of standards and becoming national standards, and any other standards or specifications or code of good practice. In addition to that, we are also responsible to establish and issue Namibian standards or amend and withdraw any Namibian standards in the manner prescribed by regulations. With the recent event of the COVID-19, the Namibian standards has developed or adopted six standards, specifically what we call the NAM-SANS 490, which is the disinfectant alcohol-based hand rub. And then we also have in Namibian standards, we call it NAM-SANS 1866 Part 1, which deals with the medical devices, Part 1 for medical face masks. Then we have Namibian NAM-SANS 1866 Part 2, which deals with medical devices on medical respirators. And these are very important and critical products that we need to have due to the COVID-19. So we already have the standards, they are gazetted and they are ready for use, and anybody who wants to purchase the standards, they are available. They can contact the Namibian Standards Institution for that purpose. However, one thing that one needs to bear in mind that the use of standards is voluntary. So if we want to enforce the use of the standards, we need to have what we call technical regulations, because a regulation is a law. So once the regulations is available, we can then reference the standards, the particular standards. In this case, let me give you an example. The NAM-SANS 490, which is a disinfectant, can be referenced in that technical regulations. We already have the regulations. It soon will be made available and gazetted. So once the regulation is out and published, then it is enforceable. So those manufacturers and producers of hand sanitizers have to comply with that specific standards. And that the standards clearly indicate the requirements as outlined by the World Health Organizations. So the Namibian Standards Institutions, through our certification body, has been appointed through our Ministry of Industrialization and Trade as the inspection authority to carry the responsibility of making sure that the products, the sanitizers that are out there in the market comply with the standards and the World Health Organization requirements.
Well, Ms. Wasserfall, you speak of a standard that needs to be met for the product to comply with World Health Organization standards and guidelines. So for an average hand sanitizer, they talk about it needs to have a percentage of ethanol. What is this percentage, and how can I as a consumer determine if that percentage of ethanol is in the product? Is it required for the manufacturer to put it on a label and so on?
Yes. Right. The World Health Organization requirements in terms of the composition of the alcohol-based hand rubber sanitizers clearly stipulate that if it's ethanol, it's about 80% plus minus 5%, and then it's isopropyl alcohol for about 85%. Okay, so it has to, when a manufacturer produce or make the sanitizers, it is clearly indicated that one has to make sure that the materials or the chemicals that you use is accompanied with material safety data sheet to make sure that you have the correct active ingredients in the manufacturing of the sanitizers.
But why is this important? Why is it important for the product to
Yes.
have this amount?
It is very important because any below the required composition of ethanol, it will not help in eradicating the spread of the coronavirus. It is very important that the required amount, volume per volume, is met, or they are met, because it will serve no purpose at all if it is below the required guideline in terms of the composition of the required ingredients in the sanitizers or alcohol-based hand sanitizers.
Okay, and finally, some people are of the opinion that they would rather like to make their hand sanitizers at home with whatever available products. What would be your advice to citizens out there who would like to make their own hand sanitizers and so on?
My advice, of course, is please don't try to make homemade, because one can never guarantee whether what you have produced really met the requirements in terms of the World Health Organization guidelines. First of all, when you purchase the ingredients, you need to make sure that the ingredients that are being used in making the sanitizer are accompanied with what we call the material safety data sheet. It is very critical, because that is the only determining factor that the ingredients that you put in the sanitizer are indeed the correct ones. Okay. So in addition to what you've asked with regards to how do we make sure that indeed the sanitizers meet the World Health Organization's requirement, in conjunction with the Ministry of Health and Social Services through their quality surveillance laboratory, we obtained the samples, or the manufacturer submitted samples to the NSI for testing. So the QSL then from the Ministry of Health and Social Services conducted the analysis based on the ingredients that are being used, whether they are in accordance to the World Health Organization guideline, and then they submit with a certificate of analysis. And on that basis, then, if the manufacturer or the product complies with the standards, then we issue with a certificate of attestation that it is indeed complied with the World Health Organization requirements.
Thank you very much. Ms. Chopala, I think there's a lot of curiosity from the nation about the people who are in quarantine. Of course, the 14 days is quite a long time, around their well-being, their health, their psychosocial well-being. What is the average day look like in quarantine? Who visits the people in quarantine? Are they allowed to be visited? Do they have their mobile phones with them? Do they have support from nurses and perhaps psychologists? And what is the morale in these quarantine facilities?
Thank you once again. You know, it's a quarantine facility. It's not a prison. They are living a daily life, just almost like the way they live at home. As I said, we assess the place before we take people there for quarantine. We have health personnel, we have public and environmental health personnel who goes out to this facility to assess them. We have a checklist with the specific requirement that a facility should meet before we put people there for quarantine. In terms of access to safe water, electricity and other utility, and just the safety of the environment around. The activity for the day-to-day, I tell you, some of our people in quarantine, they felt like, ooh, this was a holiday, just because of the comfortability that they were in. So they get assessed in the morning, immediately after breakfast. We check for this sign and symptom. Then they have other activities. Remember, this is still self-quarantine. They are not allowed to gather in group. But we encourage individual activities like reading book. To some of the quarantine facility, we took books. We have provided electronic books where are available for them to read. They have access to television. Some of these people are students. We have made sure that the establishment has got Wi-Fi so that they are able to carry on with their usual duty, either school-related activity or work-related activities for those who are supposed to work from home. We have not really received complaint related to the way of life. We do have a group of about 53 psychologists and social workers who have signed up for free to accept people to assist people during the COVID pandemic. So these social workers are almost visiting this facility on a daily basis. They do have one-on-one just to support, to provide that psychological support where it is needed and provide linkage to any other services that the people in the quarantine will require. Some of them were able to get visit from family member, but at a distance. Remember, all our quarantine facility are guarded by the law enforcement, the police, wherever we have this. It's not really to police people who are in the quarantine facility, but it's to ensure their safety. Therefore, when a family member comes either to bring supply or fresh clothes, usually they are handed over through our personnel who are on the ground, because we are trying to limit still interaction between the people in the quarantine and their family or anybody else. But it's a normal life.
Are there any challenges from the Ministry of Health side in actually giving this type of support and services to those in quarantine?
So far, we haven't really encountered challenges. And for now, because of the lockdown, we don't have a huge influx of travelers who are coming in. Really, the big groups that we have is people who have arrived before the lockdown. And a lot of them are already completing their 14 days. Like today, we have released 40 from the Hardap resort. Tomorrow, we are releasing about 46 from another lodge around here. So the number that is really coming in is truck drivers who are coming in like one by one or so, but it's not a large number. So we are not really experiencing challenges. Maybe I can say for the truck driver, because they are supplying goods, remember they might be coming from South Africa, and they are not coming to stay in Windhoek. They have to transition to other region. Usually the system that we have put in place is to ensure that we take their details at the port of entry, and we provide this detail to the next destination. For example, if they are going to Walfish Bay, we get in contact with our staff in Walfish Bay to ensure that when they reach there, immediately as they offload, then they go in quarantine. I should explain this again. When I say once they offload, they go on quarantine, they are only in quarantine for their duration of stay. If they are offloading and overnighting and going back to South Africa or wherever they come the following day, we release them the following day. If they are here for 2 days or 3 days, we quarantine them for that duration and we release them to go on with their journey. If they are returning Namibian who are not going back and they're supposed to go back home to their family, we quarantine them for 14 days. And then after 14 days, they can go back home to their community.
So this quarantine for truck drivers applies to both Namibian nationals and also foreign nationals?
Yes.
Okay. I think that's very clear. Thank you very much. We now open up the floor for questions from the media. We have one already. Can I just see a second and two in that order? All right. So the floor is yours.
Thank you so much, Honorable Minister. My name is Pancho Molongeni. I think my first question will go to our lady in the middle regarding hand sanitizers. And I also want to ask a provocative question, but it will not be as provocative as the French scientist who started with that question and it led the whole world to go crazy about the vaccine, but it's still provocative. We know that our ethanol is available in pharmacies and people are buying it, as well as methanol. You can buy surgical spirit. You can buy methylated spirits. Now, when people buy this to make their own hand sanitizer, what stops them from doing it, even though you discourage them from doing so? Because of the dangers as you listed. And secondly, we also know that there is a ban on the sale of alcohol. For people who are alcoholics, we know, and it's documented around the whole world, that they will buy surgical spirits and consume it, and they'll even buy methylated spirits, which are actually harmful and potentially deadly, and consume it. So is there any way we can monitor the sales of these products, and also in the health system, likewise, to monitor if there are any cases of this alcohol poisoning? Then the other question that I have has to do with quarantine. We know that people are quarantined, but they also heard of people self-isolating. So if I have the symptoms of coronavirus today, will I have a choice of whether I want to self-isolate at home or I have to go into the quarantine facility? Because that has consequences on whether I want to come forward. Perhaps I don't want to go into the quarantine facility for various reasons and I'll just stay with the symptoms at home. But my condition could deteriorate. If my condition deteriorates and I finally go to the ministry, will there be any repercussions for me only coming late? Or even, let's say, if I recover and I feel I'm recovered and I want to go to the ministry and just test to make sure that I recovered, will there be repercussions? And I mean, that has a bearing upon whether people will come forward. So those are the two questions that I have. Thank you so much.
Thank you very much. I think we'll do the answers and then get the second question. Yes, Ms. Vasafong.
Thank you very much for the question. In terms of the homemade sanitizers, people buying ethanol and isopropyl from the pharmacy and make their own thing, yes, we cannot certainly stop them from doing so. However, when one buys it from the pharmacy, the pharmaceutical industry, of course, will not just give it out to anyone. Wherever they buy the ethanol or the active ingredients to make sanitizers, they do accompany with what we call a material safety data sheet that would verify that it is indeed a correct material or ingredients. However, for one to manufacture a sanitizer, what we trying to encourage is for the manufacturer to comply with what the standards is as stipulated, and also to make sure that whatever product or the sanitizers they manufacture or produce has to be subjected for testing. And the NSI is through our certification department is able to assist the manufacturers to make sure that the product or the hand sanitizers that is being produced meet with the requirements in terms of the standards of the World Health Organization guideline. In terms of the banning for the alcohol, I think the appropriate enforcement agency should be able to regulate this. Unfortunately, the NSI is not a regulator in terms of monitoring who buys the alcohol and all that. All that we monitor at this stage is the hand sanitizers, the product itself that is being sold in the market out there, that it is according to the standards and NAMSANS 490, and that it meets the World Health Organization guidelines.
I think maybe just to add on the question, I think around now those who are consuming spirits and ethanol and so on. Is that in the jurisdiction of the NSI to perhaps put a regulation of saying that the person buying it should only get it in a certain quantity or so on? Is that something the NSI deals with?
We certainly can look at that. If it is required by the users or the industry, that we need to regulate it. Like what I said, we do have technical committees that look at standards that is being asked by any user or the industry for that matter. So it has to go through a process, going through looking at whether it is a correct standards for applicable to the country, because of course we just don't want to adopt any standards. So yeah.
Thank you very much. Ms. Chopala, your questions?
Mm-hmm. And thank you, Pancho, for your question. Again, let me first differentiate between self-isolation and self-quarantine. We are saying for the people who are coming in and they are asymptomatic, that's when we talk of the self-quarantining. We do have cases, like special case, that have gone into home self-quarantine. This quarantine is supervised, but it's not forced. There are cases that cannot be in the facility for quarantine, like people with medical condition, minor, and the pregnant women. And for these people who have made special arrangement, as I have mentioned there at the beginning, I said we do contact assessment. We have to look at our local context. There are people who are able to self-quarantine because their home environment will allow them to do so. But we also know that there are people who will not be able to do self-quarantine at home just because of the circumstances, especially where you have many people sharing one room. So self-quarantine is not possible. And these are the people that we have registered and have put in self-quarantine at a facility supported by the government. We have a few cases of people who are self-isolating, but even if they are self-isolating, they are still being monitored on a daily basis. And we have a full team at the Ministry of Health that we call the surveillance team. All what they do every single day is to keep in contact with the people that are in self-quarantine or in self-isolation. Maybe to summarize, to say we have provision to either self-quarantine at the facility or to self-quarantine at home. But both will be monitored. I hope I have answered your question.
Thank you. Sir, the floor is yours to ask your questions.
Very good afternoon, Honourable Deputy Minister and your panelists. My name is Denver Kisting. I'm here in my capacity as a journalist working for Rubrica in the Afrikaans Daily. I have a question for Ms. Chopala, actually 3 short questions. They all relate to patient number 16. Now, we do know that a number of health workers, specifically interns and medical officers, have been placed in isolation because of their contact with patient number 16. The reality is that these doctors have been treating patients. So I'd like to know from you, are these patients being traced? And if located, are they also being monitored for symptoms? Equally, that doctor, case number 16, is married to a medical specialist whose patients require critical care all the time. I would like to know, have those patients also been traced? Are they also being monitored for symptoms? And how would that affect the treatment that they're undergoing for the conditions that they're suffering from? And just in conclusion, could you give us an update on the 13 active positive cases? How are they doing? And have the 3 recovered foreign nationals been repatriated? Thank you very much.
Again, I want to repeat something that I have mentioned before, that the Ministry of Health have got a surveillance team. This surveillance team, all what they do every single day is to trace contact and monitor them. Now, when we are tracing contact, we do not discriminate who was the indexed case. And as a country, I really have to call upon that we be sensitive when we are talking about the indexed cases. It's not about who they are in terms of gender. It's not about their social class. It's not about their education. But every single indexed case is followed, and the contact are followed in accordance to the established procedure. Even if you are not employed, you are being asked of every single person who has come into contact with you. These people are taken in terms of their name, in terms of their address and contact detail, and we keep following them up for that duration of 14 days. I assure you, in all our 16 cases that have been confirmed in the country, we followed the same procedure, irrespective of who they are, and we will continue to do so. Also, I think part of your question relates to something that Mr. Pancho mentioned earlier on. It's an issue of stigma. And I know today, as we are here sitting in the communication center, we have to do a lot of sensitivity and public awareness when it comes to stigma related to COVID, either suspected cases or diagnosis cases. This is a national pandemic. We are still starting to understand the pattern of this disease and transmission. We know that some of our earlier cases, these were people who traveled from outside, and now we are getting cases among people who did not travel but might have contact within the community. So therefore, I'm calling upon all Namibians and the media houses that we continue to sensitize our community so that we continue to fight the disease without being obstructed by issues like stigma, which could be a very big issue in terms of people coming out and telling us when they have sign and symptom. Yes, we do have 13 active cases. All of our active cases are in stable condition. Even our cases that are usually discharged, our surveillance team continue to monitor them because we are still early on in the epidemic. Following this individual, either those who have recovered or those who are active, is very important for us as a country to understand the disease pattern for COVID-19 and plan accordingly.
My question is to the Director in the Ministry of Health and Social Services. This morning, Dr. Kandetu said that 65 people will be released from quarantine, but it was earlier mentioned that it's 40. We just want to know the exact amount of people that has since been released and from where tomorrow's people will be released. And then the second question is, it's a reoccurring question on social media and on other platforms of Namibians questioning, perhaps just to give you a chance to explain to Namibians the rationale behind not revealing the identities of those who have tested positive to COVID-19, because the argument that many people have is that if they know who tested positive, they can enhance the tracing of people others have gotten into contact with by availing themselves. If they know about a certain person, then they can avail themselves to also get tested or to be observed or whatever. Thank you very much.
Thank you. Director, yes.
Thank you so much. As I said, we do have people who are quarantined here in Commerce. And if you interview and you ask somebody from Commerce region, they will give you the number from the region. But at the national level, we do have the number that we are receiving from other region. It's very likely how you pose your question, you might get different number, whether you have asked for the number for that specific region, or you have asked for the national number, which is inclusive of people either quarantined or released from quarantine from other region. So that's where maybe the variation would come in. Your second question is, why not releasing the identity of people who test positive so that maybe we know them for whatever reason? I would say we as the Ministry of Health, we have got an ethical obligation. With ethical obligation, we have to protect personal identifying information of patients who have come into our care. Not only for COVID, we have got a lot of people who have come into our hands, into our care, with a lot of medical ailment and health. We never reveal their identity. And from the epidemiological perspective, revealing the identity of a person like name or origin does not help in terms of containing the epidemic. What helps is to understand travel history and potential exposure, to understand the age and gender, to see if we are seeing more men or women who are getting infected, and to see the age group, whether the young, the middle age, or the old people are the ones that are getting more infected. But usually a name, which is just a label, does not help us in terms of containing the epidemic. Once again, we have got an ethical obligation to protect our patients' privacy and identity.
Director, maybe if I can just do a follow-up on that. And also, we've picked it up, the query around identity. Some are saying that if, for example, they know Emma has tested positive for COVID-19, they can come and present themselves to the different health facilities to say, last week Emma and I had a lunch, and perhaps that would assist with your contact tracing. Would that be a right assertion to have, or is that not helpful for the ministry?
Yeah, thank you once again. We do contact tracing. The surveillance team has got a responsibility to do contact tracing. And usually we start with the indexed case. The person who is in our care, who has tested positive, this is the person that we ask to list the people that they have been in contact with. And each of the person who have in contact with them will also enlist the people that have been in contact with them. That's how we get to the bottom of the chain. If there is somebody who will turn up and say, I was in contact with so-and-so has informed me that they tested positive, we will welcome them and register them. But we would not necessarily go to the public and say, so-and-so has tested positive, anybody who has been in contact. I think that will not go well in terms of containing an epidemic.
Mine is just a follow-up question to Ms. Shopala relating to case number 16. In as much as I appreciate that it doesn't matter who you are, what the color of your skin is, where you're from, you treat all patients the same. In this particular case, the person's spouse, who's a medical practitioner too, is dealing with very vulnerable patients. So I would imagine that that process would need to be a lot more rigorous. Hence the question.
Thank you once again. All the contact of all the cases, as I said again, are conducted for the purpose of contact tracing. All our healthcare workers who are exposed, either by case number 16 or exposed from case number 1 to 15, the Ministry of Health have made arrangement for quarantine facility. As we speak now, there are healthcare workers who have been in contact with these cases who are quarantined. Anybody who is among the list of people who have been identified as contact are conducted even to say they should go ahead and do self-quarantine. I would think, because of our medical and professional obligation and duty, all individuals who are exposed, being healthcare worker, will be open enough to enlist who has been their contact. There might have been people who have been in the hospital exposed, and these are the people who are being followed up, because fortunately for all our medical record, when we see a patient, we do take their detail, especially the physical address, and that is helping us to be able to trace any other contact that need to be traced.
My apologies, ma'am. Perhaps I should phrase the question differently. The concern that many in the public have is that so many of us don't remember half the people we met last week, let alone yesterday. So there are people in our communities who, it's not that they don't necessarily it's not that they mistrust the ministry's ability to do any kind of contact tracing, but the argument is that if we know who is infected with COVID-19, we can assist the ministry with contact tracing by being able to acknowledge whether we've gotten into contact with certain people or not. I'm also by no means saying that people's identities should be revealed, but what's your response to the question that, considering we live in such uncertain times right now, we need to find a different ways of doing things, and that's part of the reason why people have an interest in knowing the identities of those who are infected with COVID-19. Thank you very much.
Perhaps can we just have the second question as well? Then you can tackle them at the same time.
It's again a question for Ms. Chapala. Ma'am, we do know that one of the constraints that the Ministry of Health and Social Services faces is capacity. So with at least 20, perhaps you can tell us how many health workers are in self-isolation or self-quarantine at the moment. How's that impacting on the operations of fighting the pandemic?
Yes, Ms. Chapala.
Thank you so much. I think we have to come back for another day because this seems to be a very interesting topic. I'm getting back to the question of the identity of the people for the purpose of prevention. I should say that COVID is not the first infectious disease that the country has dealt with. All have been faced with. We do have HIV, right? Which transmit from one person to the other. Never in history did we revealed the identity of people who have HIV to say, so and so has got HIV. Please stay away from. That is not our approach to disease control, and I don't think there is any other country in the world which is revealing the identity of the person who is infected for the purpose of disease control. But what we do is we provide the factors, the risk factors, and we educate the public, like we are doing in COVID, to say, observe social distancing. I'm seeing today, as we are sitting, we are not observing the social distancing at some of us. Those are the critical part that we should pay attention to. Social distancing, washing your hand, and sanitizing. The mentioning of name will not help us in addressing the epidemic. And I think that is not an area that we can make any promise. The last question is about how many healthcare workers are in quarantine. How is this affecting our effort to address the epidemic? As I said, we do have a few health workers that are on quarantine, especially those who are taking care of these confirmed cases. The protocol is, if the nurse is taking care of a positive case, they will remain in quarantine. Once they are off duty, they will still have to go on quarantine for 14 days before they go home to their family. This is to make sure that their family is not exposed. But if we look at other countries that has faced this pandemic first before us, it's a huge burden on the healthcare worker. I'm just giving an example that if somebody who is infected comes into a clinic, usually they will see a nurse who will take their parameters. Then they will see a nurse who will screen and treat them. They might be referred to a doctor. Then they might be referred to a pharmacy. They might be referred to an X-ray. If in the end, this case is positive, all these healthcare workers that have been in contact with this case will end up getting into quarantine. Therefore, as of now, and what the ministry has been doing in the past week, is to prepare to ensure that we have enough healthcare workers to be able to come on board, either on a temporary arrangement in case we have a large number or a high number of our healthcare workers who are quarantined. This does not only apply to the healthcare worker, it applies to all other public sectors. If an employee within your office become or test positive, then some of the employees in that office have to be quarantined. Each sector has to prepare how are we going to address this issue in case a person within your area of employment or your institution tests positive for COVID and others need to self-quarantine? How are we going to deal with it? We have never dealt with it before. We are doing it for the first time, and we really appreciate the support from the various sectors who have come on board in terms of just developing strategies how to address some of these challenges.
Thank you very much. All right, we're now moving towards the end of our discussion. I'd like to give Ms. Wasserfeld to give us some final remarks around some of the issues discussed here around hand sanitizers and the quality thereof in order for people to actually be protected as they use some of these products from manufacturers.
Thank you very much. I think my message to the users like us, we have to be very vigilant in terms of what the products that are being sold in the market. Seemingly sanitizers that meet the World Health Organization requirements, which are not really, we're not sure whether they are indeed meeting the requirements of the World Health Organization requirements and the standards that we have. So for the users, please, my advice is to question where you buy those, whether they have been tested from the NSI, whether those products have been subjected to the process of certification as already discussed earlier. To the manufacturers, it is the responsibility to comply with the relevant standards. Again, let me repeat that, NAMSANS 490. That you need to contact the NSI to have your product tested so that we can then issue a certificate to make sure that you just don't sell anything that is not according to the standards. Certification is required. Once the regulation is out there, you need to get and obtain a certificate from the NSI attesting that the product meets the requirements according to the standards and the World Health Organization requirements.
Thank you very much. Ms. Chopala, as you give a conclusion, I just wanted to say that, of course, as a country, we have 16 cases, 3 have recovered and no deaths. Perhaps you could just shed a little bit on this positive light on how we are containing COVID-19 and then also add your final remarks to encourage the citizens to continue taking in the guidelines and regulations put in place as per COVID-19 and continue practicing those so that we have no more increase of such cases.
Thank you once again. Yes, in my conclusion here is still urging the public not to panic, to follow the guidance that is being given, to observe social distancing, hand washing, frequently sanitizing your hands, and to continue engaging in public and community awareness and education so that everybody is informed on this measure. And my last statement would be, let's continue to fight COVID, but not those that are affected.
Thank you very much. Thank you, ladies and gentlemen, for joining us this afternoon for our COVID-19 4 o'clock health update around quarantine issues as well as standards issues with regards to hand sanitizers that we continue to use. As earlier alluded to and continuously being done so, please continue washing your hands as well as informing yourself with facts and verified information around COVID-19, but also practicing social distancing and encouraging those around you to do the same. Please do not hesitate to contact the Ministry of Health toll-free number that is 0800 100 100 for any queries or questions you might have, as well as reporting any suspected cases of COVID-19 and for you to get that advice. Also, do not hesitate to contact us here at the COVID-19 Communication Center with your questions and queries as we continue to talk about COVID-19 and the impact it has on the different sectors in Namibia. That is at the email covid.nam@mict.gov.na. That's covid.nam@mict.gov.na. Thank you for joining us this afternoon. That's all the time we have. Have a good evening.